You've published in some of the world's top medical journals. Is that something you want to continue to do here in the UAE? And does that opportunity exist here?
Yes, so absolutely. That is definitely something. So obviously, in the first 9 months, I've just been trying to establish myself, and I think I have done fairly different things in this last 9 months as well. But yeah, I think for anybody who's interested in research in a serious way, there are lots of opportunities to do research at King's College Hospital Dubai, to collaborate with other hospitals across Dubai, to collaborate with the medical universities, collaborate with the DHA and the public health system here. There is a research and ethics committee in the hospital, much in the same way as there would be in any NHS hospital back home in the UK, with a very sort of keen scrutiny on the quality of research that's being produced. I've had an opportunity to attend some medical conferences while I've been here in Dubai, and again, I found them to be very informative, helpful, both in keeping up to date with my medical education, but also meeting colleagues from elsewhere in Dubai, and integrating into the system. So I think, whether you're looking for opportunities for research or whether you're looking to collaborate and sort of, audits, etc., there's plenty of opportunities in Dubai to get involved in that. And I look forward to doing that in the future.
That's amazing. Some of the questions that doctors ask before relocation, they share with us their fears, and some of the fears they have is that they may lose their skills here because of lack of patience. There is that misconception. Is that reality? Would doctors really lose their skill here? That's some of the questions we get.
So I don't think you lose your skills. I think there's definitely something to be said about a different case mix here than you would see back home in the UK. So back home in the UK, it's an aging population, and you see a lot more elderly people, and of course, the population of Dubai is a younger working population. So it is rare to see. I wouldn't say it's rare, but the majority of your patients are under the age of 70 and probably even under the age of 60. So of course, you're going to see a different set of pathologies in this age group. But like I said, there is the opportunity to gain new skills and to gain new knowledge bases because you're being exposed to such a diverse diaspora, people coming from all around the world to seek expert medical opinions. So that actually, I feel that where there is a little bit lost, there is also a lot gained. So overall, I don't think it changes the balance. And also here, there is an easy access to so many more therapeutic diagnostic modalities that you wouldn't have back home. So I've actually learned new skills in my last 9 months here that I hadn't done back home. In terms of the access that we have to a different kind of infrastructure, it is the most evident for me in the transplant team. So King's College Hospital Dubai has been recognized as a center of excellence for liver transplantation now. And they've been doing liver transplants since 2023. And really, every year, they've just grown from strength to strength. So we have quite uniquely a small but very collaborative and present in-house transplant team made up of HPB surgeons, intensivists, liver transplant anaesthetists, liver transplant coordinators, and of course, transplant and hepatologists like myself. And we all work really closely together. And one of the really unique things, which we didn't have actually back home, is that we actually do daily ward rounds, all of us together.
Wow.
And so any complex hepatology patient or a transplant patient will be seen jointly on a ward round by the surgeons and ourselves. And what that means is there's real-time collaboration between the teams. We're thinking on our feet. We're thinking, would surgery be the best option? Would would a medical intervention be the best option? And we're having these real-time discussions without any time delays where you would have back home where a surgeon would come and see the patient, then a physician would come and see the patient, then they may talk to each other, So there's no delays. And we're both working collaboratively together to make sure that we provide a solution that is specifically tailored to our patient as opposed to just an algorithm. So, this works really, really well. And other examples of access to things that we have here that we didn't have. So, for example, King's College Hospital offers an MR elastogram. Now, this is used to help establish just exactly how much fibrosis or scarring there is in the liver. And back home in the UK, there would be patients would have to have a liver biopsy because an MR elastogram is only available in research settings in a couple of hospitals up and down the country. So actually, my patients never had access to that because I didn't work in a research center. But here we offer MR elastograms to all patients outside of research studies, and that means that they're having something that's less invasive, less painful, less potential of complications, probably equally expensive. So actually, it's not a financial decision. This is a decision made for what is best for the patient. So on multiple levels, I think that I'm able to offer more to my patients here than I would have done back home. And, certainly I feel that I'm part of a premier hepatology team at King's Hospital Dubai. So I would encourage physicians who have patients with complex medical disease, if they're considering transplantation, if they feel that the patient's arrived at that point, to refer patients to myself, team at King's.
That's excellent. That's excellent, doctor. So I would like to know, how was your experience with allocation assist? What did the journey look like for you?
So just going back to steps, saying that, I spoke to a lot of colleagues here to find out what it was about, what it was like to do medicine here, and they were very kind to point me in the right direction towards allocation assist, because you're absolutely right. Back home, there's usually one portal website, and you can go to that NHS portal and you can see all the jobs that are advertised in your specific field, and you can apply for those jobs. But that isn't the case here. And when I went on the net, there was nothing that I could find. I read about different licenses, but I didn't understand the differences about which license to apply, how to apply for it. But luckily, like I said, I'd spoken to people who said to me the simplest and the only way of doing things was to go to allocation assist. So that's exactly what I did. I was a little bit hesitant at first. I was like, I've never, like I said, back home in the UK, you don't have a recruitment agency to go to.
Yeah.
So I was a bit hesitant, skeptical of that concept. I was like, how does that work? But actually, after the very first conversation that I had with Emily, the founder of Allocation Assist, I was very reassured that this was exactly the right thing to do for me. She was very supportive. She was very informative. She was very friendly. And, she told me, because I had no idea about salary structures, the kind of hospitals there are, the different tiers of hospitals, how you would go about getting a job. So I think, it was very, very reassuring to have a conversation with her, and she reassured me that she would handle everything. And actually, the rest of the team was equally responsive, equally helpful. If I sent a message, somebody got back to me with a prompt reply. So this was really very easy to navigate. But I do believe that if you don't do that, it can be very difficult.
Yeah, very difficult in a sense, in terms of timeline, in terms of...
I think in terms of understanding the licensing process, I think that licensing process is quite complicated. And, luckily, I didn't have to do any of that. So that's first. But also in understanding the different kinds of hospitals and which hospital might suit you best. I really had no understanding of the sort of healthcare system here. And I think Emily did the right thing and found me the absolute right job for me. I feel really a home in King's Hospital Dubai. It's the right hospital for me. And she did very well in understanding my skill set and my personality. And she placed me in exactly the right hospital.
That's amazing. Thank you so much, Dr. Pooja. So, do you have any advice for doctors watching this right now who want to make the move but are hesitant or don't really know where to start? Do you have any advice?
I suppose, like all the things that I've said earlier, is that it's difficult, but it's rewarding. It's worth it. There's going to be a steep learning curve, as there is going to be with anything new, but that you're going to find it challenging, and then you're going to find it a growth experience, and you're going to find it rewarding on so many multiple levels. Like I said, I feel very professionally satisfied here at King's College in Dubai, but also my entire life, overall quality of life has really improved. Dubai has a very cliched image of shopping malls and 7-star hotels, but Dubai has so much more to offer than just that, and I was so pleasantly surprised. We're a very active outdoors family. One of my favorite things to do in Dubai is to go for a walk in our community, and the amount of flora and fauna that is out there right now, beautiful trees, flowers. I'm part of a gardening WhatsApp group now and looking at people's vegetables and fruits, trying to grow our own. It's the wholesome life experience that you want that you can get here. My children love going on hikes and walks, and there are so many available in and around Dubai. One of the things we've enjoyed the most is, if you say to my kids, what's the best experience of Dubai, they'll say it's going for night swims. So in the summer, we would sort of be done with our dinner and everything, and then we'd go for a night swim. And this is something we've never done back home in the UK, where the waters are freezing cold, right?
Yeah.
And we've enjoyed that so much. We played paddle games on the beach, which is, again, paddle courts are all indoors back home. So playing paddle not just on an outdoor court but on a beach. So I think Dubai has the whole package. It has a professionally rewarding and challenging life, and it has a wholesome family life.
Thank you so much, Dr. Pooja, for coming to our podcast today.
Thank you for having me.
If you're a Western trained doctor ready for more, message Allocation Assist Middle East today for a full consultation on salaries, contracts, and medical license in the UAE, Saudi Arabia, or Qatar.